What's up, beautiful people? So today we don't have a study. Um, a lot of people find my clinical reviews helpful. They tell me so. They don't gain a lot of traction. So, and they're not really meant to. They're not really meant to be things that a lot of people share or things like that. It's it's educational. It's not edutainment, right? There's no virality to it. So, what I wanted to do that I think would be more shareable or, reach larger audiences is talk about some of the ways that we use healing arts. And what do I mean by healing arts? That's everything that we do with patients. And this could be various different healthcare providers, but I want to talk about my experiences, and it'll be a new series called The Healing Arts. So, the first thing I want to talk about here, and shameless plug, I talk about this in my book, White Coat, Heavy Soul, available in print and audio, is empowering questions. I often see from people that they are their own worst enemies. What I mean by that is if you don't visualize your success, it'll never happen. If you don't visualize the path, you'll never create it. If you doubt yourself or if you put limiters on yourself, there's absolutely no person or situation that can take those off. So it all starts with us and all starts with our mindset and all starts with how we perceive the world. I've talked about this before. I used to think that exercise was the most important, and then sleep was the most important, and then nutrition is the most important. Those all start downstream from our mindset and how we perceive the world and our perceived value of those interventions. Because, and this is my MBA brain thinking, it's all a trade-off, right? It's all finite resources. Our time is a finite resource. Our time is our treasure. It's our most valuable resource. And we get to choose what we devote that time to in each 24-hour cycle. And so, because of that, our beliefs and our perceptions and our perspective will guide how we choose to spend our time. And so if you ask yourself empowering questions, it changes things. So the story that I talk about in the book is a patient came in for a lab review. I didn't order their labs. I'm going through their labs and I find that they have prediabetes. Their A1C was like 5.8 or 5.9. I've talked about before how I think the lack of attention to prediabetes overall is very concerning because we know that prediabetes increases risk of cardiovascular disease, kidney disease, certain types of cancer, dementia, increases the risk of neuropathy. Did I say kidney disease? If I did, oh well. So it's a very serious state. And we know that within a few years, a lot of people who have prediabetes, if they don't continue or if they continue on the same path that they were on, will convert over into diabetes. So it's a serious condition. It needs to be risk mitigated. So I'm telling this patient about prediabetes and her risks. And I talk about cardiovascular disease. She doesn't care. I talk about cancer. She didn't care. I talked about Alzheimer's. She leaned forward and said, my mom or a relative, I think it was her mom, died from Alzheimer's. What can I do to not get Alzheimer's disease? So I talk about for prediabetes, there's really two main levers in our behavior set. One is nutrition, the other is exercise. These are the main two. Of course, adequate sleep and stress management, all of these things play a role on blood sugars. But the thing that I try to get people to buy into first is exercise and nutrition. So I talk about nutrition, not over consuming calories, losing excess body fat will help, eating more fruits and vegetables, more fiber, lean meats, all that good stuff. So she says, yeah, that sounds good. And then I say, okay, the next one is exercise. And I've said this before, but the number one thing I tell people to do to benefit their health that pisses them off is exercise. And I get the typical response, well, I don't have time to exercise, in a very irate tone. And I don't know if that's because we tend to associate exercise with the cosmetic benefits. So when people tell us we need to exercise, that internally makes us feel bad about ourselves, like we're not attractive or anything like that. This is not about that. This is about health. And so I get this response a lot, and it's kind of like this angry response. And I asked her to do a thought experiment with me. And I said, "Are you willing to do this?" She goes, "Yes." And I say, "Okay, ask yourself, instead of saying, I don't have time to exercise, ask yourself, how do I make an exercise routine work?" And she kind of sat there and I said, "No, do it out loud." And she reluctantly did it out loud. And I didn't say anything. And within a few minutes, she went from, I don't have time to exercise, to laying out a full exercise routine, what she was going to do, where she was going to do it in her day, what resources that she needed to do. And because we all know how we could do this, we just oftentimes dismiss it behind, I'm too busy, or I don't have enough time, or some other excuse. And when you make these types of excuses, your brain will begin to validate why that is the case. It'll begin to pull in every single data point that suggests why you don't have time to exercise. Well, I know the average American adult spends 2.5 hours on social media every day. It seems that people who don't have time to exercise often know about the latest TV show or TMZ scandal or whatever, right? So it's all about priorities and perception. And when you say an empowering question, how do I make this work? What do I need to learn? What tools or resources do I need? Where do I find these things? Your brain begins to figure it out. And so that is the first healing art that I want to talk about, is always, always, always ask yourself empowering questions. Remove the limiter that you place on yourself. Because if that's there, there's nothing anyone else can do to help you. You have to remove it. You have to ask yourself the empowering question. And that's when transformation can happen.